So ma'am, we'll just do a little bit of a pivot and hear the perspective about elderly care now, because I think we have covered childcare in a very comprehensive way, but we are obviously going to start looking at elderly care as the next, sort of biggest challenge. So what are you seeing, ma'am, as you are a practitioner? How are you seeing the sector, and what are some of the challenges and also best practices that you have come across?
Thank you. Thank you so much, Mitali. A very good afternoon to all of you. So after the tall Devmalya, I request that I be allowed to sit here, because you'll only hear me if I go and stand there. So I hope you don't mind my sitting down and talking to you. So I come from the city of Pearls, and I bring you love and warmth from there. I come from Hyderabad. I have founded and run a home healthcare company that is focused on providing care to seniors. So we provide home health care to seniors across 5 Indian cities, including Hyderabad. At one point we had operations in Guwahati. I'll touch upon this as we come along and why we don't have this operation right now. But we have been invested in and partnered by Government of India, the Ministry of Social Justice and Empowerment, under a program called the SAGE, which is Senior Aging Growth Engine. And we also have been invested and partnered by a very interesting French company called Group SOS, which is a community-based organization and one of the largest social enterprises in France, which works on 2 things, among many other things, which is providing home health care and training migrants to become geriatric home care workers. So we are also right now part of a very interesting program called the Asia Pacific Care Accelerator. Now this program is run by led by the UN Women. They have a number of collaborators including IDRC, SAFIM, Visa Foundation, etc. What is the objective of the Care Accelerator? They basically work with care enterprises across the Asia Pacific region in cohorts. So it's a 10-month-long program where they work with enterprises like us and help us do what we are doing better, which is providing care, whether to the elderly, people with disabilities, or children. Then they help us make our enterprises more gender inclusive. They help us think through how do we create good quality jobs. One is about creating jobs. Second is how do you think about good quality jobs that you can create. And how do you, how do you focus on quality of services and still remain financially viable, right? So we are in the second cohort of this program. There are 13 enterprises, and from India, you'll be happy to know, there are 4 enterprises including us. Now, what have we done so far? We work in 5 cities like I mentioned, and we have provided 6 lakh days of care to seniors across these 5 Indian cities. That is quite a big number. And this is since 2014, so close to a decade. And we have worked in the process with about 4,900 caregivers who are from various Indian states, migrants. My workforce is mostly migrant. Majority is in the 19 to 22 age group. They are women in majority, and mostly the first generation workers in a formal workplace, right? That is the profile of people. And we have also trained about 1,000 young people to become geriatric caregivers. Barua sir, who was talking in the morning, was the MD of Numaligarh Refineries when he actually supported us with a 4-year-long program to train young people in Assam to become geriatric carers. And I'm happy to tell you that we have trained 1,000 and certified about 800 people to be geriatric carers. Now, people have talked about the percentage of population, and look at those numbers. Senior population, we are looking at 14 crore seniors today, which is going to get to about 32 crores as we touch 2050. It's going to surpass the number of children. Ma'am referred to the changing shape of the pyramid. So we're going to see a lot more people at the top there who are going to be seniors. Now, why is it important to think of care to seniors? There is data to say that about 10% of seniors require some kind of care for their health, right? Now, I want to quote on something called LASI, which is the most authentic kind of data that is available about seniors. This is very interesting, mind you. 10.5% of seniors have at least one physical or mental impairment. 23.8% have at least one activity of daily living limitation. What is ADL? Eating your food, taking bath, going out for a walk. That is called ADL, activity of daily living. At least 23.8% have one limitation there. At least 10% use one assistive device. This is from LASI. And then there is another very interesting data from the National Institute of Aging, which is a correction of the people with dementia in India. So there is the dementia report, but this estimate says that the dementia in the dementia report, actually it is a higher percentage. So it is 7.4%, which is today about 88 lakh people who are living with dementia. And what is more worrying is that we only have a 10% diagnosis for dementia, right? So you know, the life expectancy at birth has been over a period of time increasing, which is a very good thing because all of us want to live long, live well. But the problem is that none of us have seen, you know, our elders take care. This generation, which is taking care of seniors, we may not have seen our parents take care of their parents because of improvements in longevity. So when you look at seniors, you are talking about people who are 60 to 90 plus, right? And they are very heterogeneous. So we cannot think of them as one large homogeneous group. They are not homogeneous, they are very heterogeneous. And the burden of disease increases as the age progresses, including dementia, which age is the most important risk factor, right? So we are looking at, in terms of services that may be required, broadly it can be categorized as preventive, promotive, curative and palliative. Quickly give you examples. So preventive may be about managing diabetes and hypertension. Promotive may be about thinking about what kind of vaccinations are required to prevent diseases. Curative may be about thinking about how to handle, you know, medication when there are multiple medicines. And palliative is like end of life. How do you ensure pain-free, good quality of death? We talk about good quality of life, but we are talking here about good quality of death, right? And we see a lot of multimorbidity and polypharmacy among seniors, right? Now, what about the preference of seniors? Where do they prefer to age? I couldn't find data in India, but there is a US research. There are multiple US researches on what is the preference of elders. And there is one study which says that 93% of the seniors want to age in place. What does that mean? They prefer to age in their homes, right? So I want to quote this report: the ability to live in one's own home and community safely, independently and comfortably, regardless of age, income and ability level, right, is an important goal. This is as stated by CDC, which also was a partner to this study. Now, how can we enable this? And I'm sure that people here are not going to be very different. Can I ask you a question? How many of us here want to age in our homes? I see a lot of very young people at the back, but I still want you to think about this. How many of us want to age in our homes? So the others, I assume, don't want to age at home. So where do you guys want to? I'm not surprised. In one palliative care course, we were asked by the instructor, how do you want to die? Do you want to die suddenly, or do you want to, know well in advance you're dying? And I was one of those people who didn't say yes to both. And the instructor said, so you don't want to die? So, yeah. So I think the answer is that all of us, if given an opportunity, we want to age in the comforts of our home, right? And irrespective of our abilities, mind you, right? So, and for this, we need professional caregivers. They are the answer to that, right? And I tell you, from giving the 6 lakh days of care, that the demand far outstrips the supply, and I am only today able to cater to upper middle income and wealthy homes. And there I am saying that the demand far exceeds the supply, which means that, there is a huge need for professional caregivers to be made available to the economy, to the country, to communities. And Government of India even talks about creating a workforce for the world. I know that we have MOUs with Government of Japan. We are having mechanisms to send caregivers to Israel to become caregivers. But who are the people who are going? They are not caregivers. You are losing your nurses to caregiving jobs in these countries, right? But what does that indicate? It's a good thing. It indicates that there is a huge demand. People are willing to pay, right? Now, even after working with 4,900 caregivers, I say that my biggest problem is that of supply. When I go to I work only with the Health Sector Skills Council, and when I go to their partners to recruit, if there is a class of 200, I get, in a very best scenario, I get only 20 people who say they want to work with me. Only 20. And when they turn up, within 1 week, I lose another 5. Seriously, when they are posted, they are just overwhelmed and they just drop out. So I am looking at 15 people, and if by God's grace these 15 stay, they work, an average number of working days of those 4,900 people is 6 months. Can you believe that? So I have to build my enterprise with a workforce that is changing once a year.
Yes.
Yeah?
I can empathize.
You understand that, right? And where are they going? Where are these people going? They are going to work in hospitals where the wage is half of what I am offering. And these are not wealthy people I am talking about. Not wealthy people, right? What's the problem? The problem is that we want dignified jobs. Our youngsters want dignified jobs. The home care work does not meet their aspiration, right? And when I work with, most of my workers are 10th or 12th class pass people. And it is a struggle. When they come, they are so proud to be 10th or 12th class pass, and we should not let their spirits be killed by saying that you're going to be a domestic worker. And that is one thing that we do very actively. Our biggest challenge is to educate families that these are not biased. Sorry, I have nothing wrong. I have respect for people who help us at home. But this cadre is a healthcare cadre. It is not a health. It is not a home health cadre. And I still struggle with getting people, even when I have a very strong stance. I have a written contract that I enforce. I pull out people when the client gives domestic work to my care workers. My clients don't like it one bit. They say, I paid so much, she's sitting idle. I don't listen to all of that, because I am looking at the growing population and the need to build a cadre. We need these youngsters to, want to feel pride to say that they are caregivers, right? So we cannot let caregivers become domestic workers. Then what are we essentially talking about? We are, and this is something that I am, thinking out aloud. So there is a need. So along with building, dignified workplaces where the caregivers can trust, there is convenience, there is accountability to them, right? You answer their questions on why they were paid so much. They have a contract that protects them, right? Even after building that, there may be some people who leave. So, and one-on-one care is not the solution to handle care for a large population, for people at the bottom of the pyramid, people who are lower income households. So can we, for example, think about community-based model? And there are examples of this being done in a cooperative format.
Okay.
So you create cooperatives of caregivers who work together. Now, how will you regulate? If I run 500 services sitting here today, I have a tab with me. I open my tab. I have a technology platform that lets me see what is the patient care plan of somebody sitting in Hyderabad or somebody sitting in Chandigarh, right? So technology is a very big enabler. We need to regulate 2-3 things. One is the identity and safety of this person who's going to the home. Just the same way you will protect the safety of the senior who's receiving the service, right? Then it is about continuous education, because when we think about doctors, there are specialists, right? And we expect a caregiver who was handling a post-operative care to come to our mother who has dementia and say, okay, I am going to be fully in charge. Doesn't work like that, right? So you need to constantly train your caregiver to be equipped with the knowledge and skills required to handle different kinds of conditions that our seniors present with. And the third thing is about monitoring what is happening there very closely. And if you are going in a cooperative model, it is about aggregating demand, right? So aggregating demand, managing quality, using technology is something that should be done. And I think from the public system, and many of this we should think of it in mixed models. Some private sector, some completely public sector, and some mixed public-private, partnership models we should be looking at. And is there also, I want to place this, is there a possibility for a single window for all public entitlements that my young caregiver is entitled to? You don't make it hard for them. Make it easy for me as an entrepreneur to draw down those public entitlements and give it to my caregiver who migrates from Orissa to Hyderabad and works in Hyderabad. She still needs the PDS. Please give her the PDS. She still needs the health insurance. Please give her health insurance. She still needs hostel support. Between governments, you figure out how does one government work with the other government to transfer that. Maybe transfer credits. Why is it so hard? You have technology, right? So, and we are one large single country. So why let the state boundaries define what our people are entitled to? What is easy for them to draw down on? When we have public schemes, they should be made available to people no matter where they are. So I think, last line. So I think the journey for our caregivers should be up and forward.
Yes.
Up and forward. That is the only way we can assure good quality care for our seniors.
Yes. Exactly.
Thank you.
Thank you. Thank you so much, ma'am. Such phenomenal ideas. We have noted it all down. And I think we will definitely be featuring your organization and your work as a case study in our report, because there's so much rich insights from your experience of managing so many care workers, of the practical challenges that you are continuing to face. And we fully empathize with having a new workforce every year. We have a new workforce in our think tank every 6 months. So we are all, I think, dealing with this, but the scale at which you are dealing and the specialization of the care workers, which you just spoke about, is definitely a challenge that keeps coming up again and again, and which we definitely need to address. So with that, we'll close this panel.